2 years ago, Emily Whitehead was just 5 when her mother, Carrie, felt something was wrong.
I noticed one evening when I was giving her a bath that she had a lot of black and blue marks all over her body.
Emily had ALL, acute lymphoblastic leukemia. It's curable in 85% of children who undergo chemotherapy. But for Emily, chemo didn't work. She thinks her dog Lucy knew it first when her cancer came back.
She wouldn't play with me or anything. She would just sit.
Do you think she knew you were sick?
Yeah.
Emily was too sick for more chemo, so her family turned to an experimental therapy at the Children's Hospital of Philadelphia. Dr. Stephen Grupp is leading the study.
This is a whole new way of treating cancer. And the idea is that we're redirecting the cells of the immune system against the cancer.
Scientists use the patient's own immune cells called T cells, white blood cells that help fight infections. They remove the T cells, genetically engineer them to attack leukemia cells, and inject them back into the patient. The engineered T cell in gray attacks the cancer cell tinted green.
The cells actually grow within the patient and can attack a large amount of cancer cells.
Emily received an infusion of her engineered T cells last April. She suffered life-threatening complications.
They took us out in the hall and said, there is no room to get sicker. She is as sick as you can get. You know, they said, you should call your family in. There's a pretty good chance she won't be here in the morning.
Doctors managed the toxic effects, and 10 days later, she showed dramatic improvement.
We can't find any leukemia in her body using the most sensitive tests that we have.
Emily has been cancer-free for 8 months. If it doesn't come back for 2 years, her doctors can declare her cured. Eleaine Quijano, CBS News, Phillipsburg, Pennsylvania.